One of the striking things about London, which is a world-class city, is that we are not, or we don't enjoy a reputation for excellence in cancer care, particularly in urological cancer care. Within North Central and North East London, which is the area that we're talking about, there's no single centre that currently has any national or international reputation for excellence. That, I think, will change as a result of this structural improvement in care. So cancer surgery within London has typically been done by lots of small hospitals, which means that no one hospital and no single provider or surgeon ever gets the opportunity to build up a lot of experience. That's been a problem because we know now almost irrefutably that the evidence is that the more a surgeon does and the more a centre does, the better the outcomes. The reasons for that are complicated, and it's more than just the more I do, the better I get. It's about teams working together. It's about sharing expertise. It's about learning from peers. It's about creating a little competitive environment so that you get very ambitious people working together and they improve as a whole. Moreover, if you have high volume, you attract very good people who can also raise your game. It also makes training much easier, so people can learn the skills much quicker if they're exposed to seeing and witnessing many operations within a short period of time rather than seeing one a month, say. The remarkable achievement is to go from below average to best in class. I think that can only really be achieved by one centre. If we go to two centres, we will go from below average to average European, and I don't think it's worth the effort to go from below average to average European. I think this is a big restructuring. It's painful for a lot of people. I think the only merits of doing that is to go from below average to best in class, so that Londoners really get the best care that is on offer in Europe. Some people have said that by limiting cancer services to one hospital, we are limiting choice. I can see why people think that might be the case, but in fact the opposite is true. Until now, you have had your cancer care in the hospital that you happen to end up in, and that's largely based on chance or where you happen to live. It's a postcode thing. By coming to a centre that has access to all the technologies, patients will have available the full spectrum and range of choice, which isn't available to individuals currently. Travelling is a really important issue, and everybody has relationships with their local hospital. The thing to remember is that 99%, and indeed in most cases 100% of the pathway will be delivered locally. It's only in some patients at some point in time that that component of the pathway will be delivered in what we're currently calling the centre, and that's because that component is so difficult to do. Most patients will be diagnosed locally and treated locally. The events that we're talking about are once-in-a-lifetime events that hopefully will last sometimes less than 24 hours, sometimes 24 hours, and in the really big operations, maybe 5 to 7, maximally 10 days. The very common interventions that we're talking about will be towards the lower end of the scale. Prostatectomy should be able to be done with one night stay. So the most common operation that we'll do will last a very short time and will involve men that are fit and able to be discharged early. So the burden on any individual will be very small. Communication will be slicker and quicker, so the GP is always knowledgeable about what's happening to the patient, and that an event or a spell within a hospital that isn't familiar will be as short as possible, as effective as possible, and the patient will be returned to home or to the local institution again as quickly as possible. The other really important thing that concentrating services allows you to do is to include more women in the workforce. This is really important as we move forward. Most of the people graduating from medical school in the country today are women. For women to work in a surgical specialty, we need to create an environment in which they can work in a flexible manner. And surgical skill is equally distributed amongst men and women. It is extraordinary that we systematically exclude them by the nature of the jobs that we force them to do. If in London we don't change, we will continue to offer the population of London substandard care. I think this is a great opportunity for the people of North London. I think they've been disserved by cancer services historically. I think there's evidence to show that that's the case and that the outcomes are not as good as they should be. I think this is a once-in-a-generation opportunity to change that forever. So if patients want to find out more about the items that we've been talking about, they can go to the London Cancer website, where all the documents that support most of the things I've said are easily available.